Hello, my name is Casey Whitmarsh. I am the current chair for the South Fairfax Chamber of Commerce, and I want to welcome everyone to another installment of our webinar series. And the value and the growth and development and the encouragement that we try to bring out to the community is something, especially during the COVID phase, where we can do this via webinars. So we appreciate you all coming in, joining us today, whether or not you're joining us live or you're watching this later on the South Fairfax Chamber of Commerce website. Either way, we just appreciate you being here, and we know that without your support, we wouldn't be here. So we appreciate that. Today's webinar is Get to Know Medicare, okay? It is presented by the South Fairfax Chamber of Commerce as part of our webinar series, but what we have today is a special guest, Mary Crispino, who is with HealthMarkets, and she is also a South Fairfax Chamber of Commerce member. And with open enrollment season coming open, she has graciously offered to just educate everybody, explain how it is. It's a very complicated process to go through, and there's a lot of moving parts. So it's really important to have a valuable resource of it, there to reach upon, to lean upon, to kind of give you guidance. And we certainly appreciate her being here. I will moderate today. I am the chair, as mentioned. And so first, let me go ahead and introduce you to our guest speaker today. So this is Mary Crispino. She's an independent agent with HealthMarkets Insurance Agency. This is her 10th year specializing in Medicare products, and she's a native of Northern Virginia, and she's a member of the South Fairfax Chamber of Commerce for over 2 years. So Mary, would you like to tell us a little bit about yourself?
Yeah, sure. Thank you, Casey. Well, thanks, first of all, to South Fairfax Chamber of Commerce for allowing me to do this video and do this educational event. I think it's good to have information out there at the fingertips of our members and members of our community, even if they're not members of the Chamber. So I've been working in the insurance industry for 11 years now, specializing in Medicare. Kind of ended up being a area that I really enjoy, because I enjoy working with seniors and people who end up with Medicare, because that's not only seniors, as we'll find out. I've been with HealthMarkets, which is my company. We're an agency of 8, we have 3,000 agents across the country. But what I like about HealthMarkets is we're not married to one insurance company. So I'm going to be out there looking, we're going to be out there looking for who is going to cover our customers best. And so I like it as my job's kind of like a little puzzle. I go and I do all the work and then come down with the best ideas for my customers. That being said, this is going to be a totally educational event. And I am using a United Healthcare presentation, but that doesn't mean that I'm only promoting United Healthcare. This is an educational program that they have that you can look into on your own if you want to, but just talking about educating about Medicare and what the different parts are. So thank you for letting me be here, and I guess we'll just go ahead and get everything started then. Okay, next slide. So this is going to be Get to Know Medicare, and the program's called Medicare Made Clear. And like I said, this is United Healthcare, but their program, and you can pull this up on their website, but we prefer that you use the South County Chambers website or any of the other chambers that we're using. Next slide, please. So 10 questions about Medicare. What is Medicare? Who can get Medicare? What does Medicare cover? How much does Medicare cost? Where can I get more coverage? How do I choose coverage? When can I enroll? When can I change my coverage? How can I save money? And where can I go for help? So those are the 10 things we're going to go through with this presentation. Next. So what is Medicare? Next. So Medicare is a federal health insurance program eligible for US citizens and legal residents. It's funded in part by the taxes you pay while working. So if you're getting a paycheck, you'll see Medicare taxes taken out through that. It is individual health insurance, so it is not a health family health plan. That means that spouses aren't on the same plan. It is not Social Security. Social Security are your retirement benefits that you've also been paying into. And it is not Medicaid. Medicaid is a program for people with limited incomes. And one thing that it isn't is it is not free. A lot of people think it's free until they get to time to sign up for Medicare. Next, please. Who can get Medicare? Next. US citizens and legal residents who live in the US can get Medicare. They have to be in the US for at least 5 years before applying for Medicare. And they also need to meet one of the following requirements. They need to be 65 or older, or younger than 65 with a qualifying disability, and any age with a diagnosis of end-stage renal disease or LIS. Next, please. What does Medicare cover? So original Medicare has two parts. This is what we would call the government part of Medicare. Part A is the hospital insurance. Part B is the medical insurance. So when you apply for original Medicare, which is provided by the federal government, you're going to get a card that looks like the one in the slide here. And it will tell you what your Part A and Part B start dates are. Next, please. So what Part A, the hospital insurance covers? It's going to cover your hospital room and meals, care in special units such as intensive care, drugs, medical supplies used during inpatient stay, lab tests, x-rays, medical equipment as an inpatient, operating room, recovery room, skilled nurse services, some blood transfusions, hospital care, hospice care, including medications to manage symptoms and pain, part-time skilled care for homebound after qualified inpatient stay, and rehabilitation services after a qualified inpatient stay. Next, please. The hospital insurance. These are some facts. Premium free, as far as Part A is premium free if you or your spouse worked and paid taxes 10 years or longer. So this is kind of important to remember. If you are not paying taxes, then you will not get Part A free of charge. You have to put in 40 quarters or 10 years to get that premium free. Can't be denied. You can't be denied coverage for that. Its coverage is nationwide, including qualified hospitals in the US. So one thing we'll find out about Medicare, that it generally does not cover you if you leave the US. Coverage and costs are per benefit period. So each time you enter the hospital, then your coverage costs start again. And you must be admitted as an inpatient, not on observation status. I'd just like to point out here, a lot of people, and it's been a controversy in the news from time to time the last few years, sometimes when you go to the hospital, you are put on observation. You may even sleep in a bed overnight, but you are not admitted to the hospital. I do know by personal experience with my family members that they're making sure people who are Medicare age realize that they're being held for observation status. And why that's important is observation status still keeps you in the Part B part of Medicare, which we'll go over in a few minutes, which could be more costly. Provides additional 60 lifetime reserve days. So there's additional 60 lifetime reserve days, but you are limited on your hospital days as far as being in the hospital with Medicare. Next, please. What Part B covers, that's the medical insurance. It's going to cover things from your doctor visits and your outpatient care, including both primary care and specialist visits, annual wellness visit and preventive services like flu shots and pneumonia vaccines, clinical laboratory services like blood and urine tests, x-rays, MRI, CT scans, some programs like cessation of smoking and obesity counseling, physical, speech, and occupational therapy, diabetes screening, education, and some supplies, mental health care, durable medical equipment, which are things like they have wheelchairs and walkers there, but that's also oxygen, that's CPAP machines, and it can be prosthetics. Ambulatory surgical center services, so that could be an outpatient at a, not a hospital, but a surgery center, and ambulance and emergency room services. Next, please. So some facts. There is monthly premium and it is adjusted for income for Part B insurance. Can't be denied coverage. Coverage is nationwide, including any provider who accepts Medicare. And there is a premium penalty for late enrollment. So if you need to get Part B and you don't do it when you're first eligible to do it, when you do finally get it, you could be charged a penalty for late enrollment. Next, please.
Sure.
Yes.
Mary, I have a question. So is that penalty something small or could it be pretty severe?
It could be pretty severe, and we're going to go over that in a couple slides from now.
That's
And
great.
it's generally about 10% of the cost of what the plan would, what Part B would have cost you for the months that you have missed having it. And you can only get into it one time a year. So, and there are some exceptions we'll go through.
Wonderful. Thank you.
So Medicare doesn't cover everything. That's Part A and B. It doesn't cover all of the costs of your care. You do have out-of-pocket costs with no limits. And what that means is we're used to, on the under 65 non-Medicare side, having an annual out-of-pocket maximum. Medicare does not have that. It does not cover prescription drugs, does not cover routine dental, vision, or hearing care, eyeglasses, contacts, or hearing aids. It does not cover long-term or custodial care. Remember that Medicare is actual medical insurance. It's not to take care of you as far as custodial. And they have some examples right there, like helping with bathing, eating. So you'll see different times where we talk about that after a certain point, it becomes custodial care. And Medicare does not cover that. Excess charges for doctors who don't accept Medicare assignment, and care received outside the US except for in certain circumstances. You know, example might be a military or something, you know. So next page. So how much does Medicare cost? We're talking about some of these costs, so let's dive into what it costs. The premium is, you know, just give you an idea of what the different costs are. Premium is a fixed amount you pay for your coverage. The deductible is going to be the set amount that you pay for coverage before the plan starts paying. Copay is a fixed amount, so that if you have a copay to go to a doctor, we're used to seeing that, a set amount. And then co-insurance is going to talk about where you split the percentages. And generally with Medicare, we're looking at an 80-20 split. Next, please. So here's Part A costs at a glance here. So premium, no premium, as we said before, but if you were to go into the hospital, the deductible is $1,408 per benefit period, up to 60 days. So the $1,408, the way that works, you enter the hospital, you're there for one night, I should say, overnight, it's $1,408. If you're there for 60 days, it's still that $1,408. If you go over day 60, though, that's where things start to change up quite a bit. Per day, you would pay $352 for days 61 through 90 in a benefit period. And then if you use your lifetime reserve days, which would be any days after 90 days, you pay $704 per day. If you use your lifetime reserve days, then after that, so that's 150 days, all the costs would be on you. So that's where Medicare stops paying for hospitalization. So that's one benefit period. You can have as many benefit periods up to 90 days. as you need throughout your life, but you only get that additional 60 days that's cumulative on your lifetime. So, and there's no out-of-pocket limit on that, as we discussed before. Next, please. So an example here, they have Matthew is admitted to the hospital in January and stays 5 days. He is readmitted in April and stays 65 days. More than 60 days pass between the two, the released and readmitted. And why that's important is, let's say you had something going on, you were in the hospital, they released you and you came back shortly, it's within 60 days for the same reason. Then it doesn't start all over again, it begins where you left off. So you wouldn't be getting the additional pay things, as long as they're things that are related. You know, an example of it not being related might be, you know, I went in and had knee surgery, had to stay overnight, and then I had my appendix out, you know, later on. So those would be two different animals there. So for his first stay, it would cost him just the $1,408. He was only in for 5 days, so he just pays the Part A deductible. So no additional costs after that. The second time, he pays the $1,408. That's for days 1 through 60. And then he pays 5 days, Matthew pays 5 days at $352 per day, which is $1,760. So between the two hospitalizations, Matthew would pay the $4,576. Next, please. I kind of like these examples because they give us a real good look at how it works. Now, Part B, we'll look at all the costs here. So most people pay $144.60 per month for their Part B premium. If you have income over $85,000 for an individual or $170,000 for a couple, then the rates start going up, and it's based on your income 2 years past. So they're looking at what you paid in taxes, you know, what your tax returns look like 2 years past. So as your income comes down, which that tends to happen through retirement, you may see your premium come down too. And then there's some people that don't pay anything. Maybe they have Medicaid helping them pay that out, pay for their Part B premium. So, but the majority of people pay this $144.60 per year. And I just want to point out that I'm giving out all the Medicare costs for 2020. 2021 rates won't be out until November. So keep an eye out on the news for that. And we can also update our slides for that on the chamber if we want to. So there is a deductible for Part B, and that deductible is $198 per year. And then after the deductible, you generally pay 20%, leaving the 80% for Medicare to pay. Now, the one thing that is not covered by Medicare is any excess charges, if any. And that would be the doctors or providers who don't take Medicare assignment. They are allowed to charge you up to 15% more than Medicare assignment, and that would be all on you. Again, there's no out-of-pocket maximum for Part B. Next, please.
Now, Mary, just so you know, we do have a question in here about a life-changing event regarding Part B premiums. Would that be something you'd like to address now, or would you like to wait and address it later on?
Can we address it a little bit later on?
Of course. You just let me know when.
I think that'd be best then. So Medicare example costs, here you go. With Ellen, her doctor, she wants to know what it's going to look like if her doctor refuses assignment for Medicare. So the usual doctor fee is $300. Medicare approved amount, we all see that where it's changed, actually pays $220. If her doctor, you know, takes Medicare assignment, then Medicare pays 80% of that, and Ellen pays $44 or 20% of that cost. Now, if her doctor refuses, it actually gets, the Medicare approved amount actually gets reduced. And you can see there it gets reduced. I think that ends up being it's $11, you know, 0.5%, you know. and 5%, and then Medicare pays 80%, leaving Ellen with 20% coinsurance of $42 plus the excess charge of $31. So that gives an idea of what it would look like. The good news is there's a lot of doctors out there that take Medicare. Just try to find one that takes Medicare. It's going to be better for you, but it does allow you to go to maybe some specialists if you have something going on that you need to go to. So next slide. Where can I get more coverage? So let's jump right into this. So there's options for you to get additional coverage. Everything from this point on, we're going to be talking about what you get from the private insurance companies who have contracts with Medicare and Medicaid. We will talk about how that works. So one option is to get a Medicare supplement insurance plus a prescription drug, which is called a Part D insurance. Or you can get the second option, which is a Part C, and that is a Medicare Advantage plan. And the Medicare Advantage plan, also, most of them have prescription drug coverage. However, there are some that don't have prescription drug coverage because maybe you have prescription drug coverage through the VA or another organization that gives you credible coverage. Next, please. So Medicare Advantage plans, we're going to go the second choice first here. So Part C, it's an alternative to original Medicare. The plan members are still in the Medicare program, but the benefits are administered by the plan, by the private insurance company. A little bit different, looks a little more like our benefits that we have through a work program. Next slide, please. So all Medicare Advantage plans cover all the Part A benefits except for hospice to original Medicare for that. And all the benefits under Part B. Most of the plans, like I said, offer prescription drug plan. They may also offer additional benefits and features such as dental, cleanings, x-rays, even comprehensive eye exams, eyeglasses, corrective lenses, hearing tests and hearing aids, wellness programs, fitness memberships. There can be a lot of other things too, like transportation and over-the-counter items. They all have an annual out-of-pocket maximum to help protect against high costs. So a little bit different than original Medicare there because they do have that safety net. Next slide, please. So most of the plans, there's a lot of different types of plans out there. What we see most of the time are the Home Health Maintenance Organization plans, the HMO, and the Preferred Provider Organization plans, the PPO. There are some point of service plans, and also you'll see special needs plans. These are usually either for people with chronic conditions or people who are on Medicare, Medicaid combination, so special plans for them. There are some fee-for-service plans still out there and some Medicare medical savings account plans also, but these are the two we see the most are the HMO and the PPO. Next slide, please. Fast facts. So you need to be enrolled in Part A and Part B and live in the plan service area to become a member. You can't be denied coverage based on a current financial or health status, including pre-existing conditions. Now, there's a little asterisk there that says special rules for people with end-stage renal disease. 2020, if you had end-stage renal disease, you would not be able to get a Medicare Advantage plan, but those rules have been changed for 2021, so there's no pre-existing questions on the application. May be required to use provider or pharmacy networks, so we always want to make sure that your providers are covered. Coverage and costs vary by plan and may change each year. So right now we're going into, and we'll go into the times you can change, we're going into the annual enrollment period, and all the new plans for 2021 are out there, and also the changes for the plans that have been existing are out there, so you know what they're going to be going into this period. Annual limit on out-of-pocket costs is a big one. You'll have that amount, and that's going to be for your medical costs, not necessarily your prescriptions. We'll go over those in a little bit. And they may charge you a monthly plan premium. So we have a variation in this area. So may charge you that monthly plan premium. You must continue to pay your Part B premium to Medicare though. Next slide. So Medicare prescription drug coverage, that's Part D. And there's two ways to get coverage. You either get a standalone prescription drug plan, and that usually goes with original Medicare or with original Medicare plus a supplement plan, or you can choose a Medicare Advantage plan that includes prescription drug coverage. Next slide. So Medicare Part D covers the types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. They have specific brand name drugs and generic drugs included in the formulary. And one thing that they also cover are commercially available vaccines not covered by Part B. So a couple different things on this slide I like to go into a little more detail. First of all, the formulary. Every Part D plan has a different formulary. So that formulary sets out the prescription drugs that that carrier and that plan are going to cover for the year coming up. So it's good to look at the different plans, figure out which one's going to cover your prescriptions the best. Commercially available vaccines not covered by Part B. So we know that our pneumonia vaccine and our flu shots are covered by Part B. One that comes up all the time is the shingles vaccine. That is not covered by Part B, so it's covered by your Part D. So it comes under some different rules. So that's something to be cognizant of as you're getting your plan. Next slide, please. A formulary, like we said, formulary is a list of covered drugs, and the way they usually do formularies is they have the lower cost drugs, your preferred generics in your first tier, your other generics in tier 2, and then it goes up from there. Sometimes there's a deductible on the plan, and they'll specify whether it's for all prescription drugs or for just the higher tiers. Next slide. So everybody hears about this coverage gap or this donut hole with Medicare. And so this is going to be in any plan that you get. It's not, you know, one carrier versus the other. This is set up by Medicare. So the way that it works is if your plan has a deductible, you pay up to the deductible. If they don't, you kind of skip that page. And then you have an initial coverage stage. And what happens during that is you're paying the price or the copay or the co-insurance that's set up for that tier of your drug until the total cost of your drugs, what you have paid and what the insurance company has paid, gets to $4,020. Once you get to that point, you are in what they call the donut hole or the coverage gap. And while you're in the coverage gap, you are going to pay 25% of the cost of both your generics and your name brand drugs until you get to the other side of the gap. So we're all looking for the plans that are going to have the lowest out-of-pocket for ourselves. Now, there are some plans that give you a little bit of help during the gap. So that's something also to take a look at too. The dollar amounts change per year. And most people, or not, I shouldn't say most people, but a lot of people don't ever hit the coverage gap. Now, when you come out of the coverage gap, that is when the total cost of your prescriptions gets to $63.50, what you've paid out, and you also get credit for what the pharmaceutical companies are paying too. So you get some credit there, and once you get to that, through that, you get to catastrophic coverage where you have set amounts for generic and prescription drug and name brands, or you pay 5%. And then the cycle starts all over again January 1 of the next year. Next page. So you must be enrolled in a Part B or both. May be required to use a pharmacy network. Coverage and costs may vary by plan and may change from year to year. And there is a Part D premium penalty for late enrollment. In fact, that can be for late enrollment or anytime you go over 63 days without having a prescription drug coverage considered credible coverage under Medicare. Next slide. Medigap insurance or Medicare supplements. They're the same thing. A lot of people don't realize that they're the same thing. So what happens with the Medicare supplement? You have to have parts A and B, and it supplements that depending on what plan you go with. It can't be used with a Medicare Advantage plan. You either go Medicare Advantage or you go Medicare supplement and possibly a prescription drug plan. There are 8 plans with benefits. They're all standardized by the federal government. So a plan with one company is going to be the same with the next company. Let's say it's a G plan. It's going to be the same with each company, except for in the 3 states here. None of them are Virginia. So it's Massachusetts, Minnesota, and Wisconsin. And they are offered by private insurance companies. Next slide. So these are the things that Medicare supplements could, or Medigap plans can help you pay for. They can help you pay for your Part A and Part B deductibles, your copays, your coinsurance, and even the excess charges your providers might tack on. Cost for additional 365 days of hospital care after lifetime reserve days are used. Cost of blood transfusions, the first 3 pints. This is a little caveat in Medicare. I'm not quite sure why they have it, but they do not pay, Medicare does not pay for the cost of the first 3 pints of blood. The cost of foreign travel, that can be added onto, or that is on some of the plans. It does not cover prescription drugs, dental, vision, hearing, eyeglasses, contacts, hearing aids, extra days in the skilled nursing facility after Part A benefit. Like I said, that's one of the places where it's going to long-term care. Custodial care, again, that's long-term care. And at the bottom there, long-term care. So it's only going to be medical type things that they're going to be covering, not the custodial care. Next slide. So here are the standardized plans. You'll see the one that covers the most is right there in the middle, Plan F. You'll see it covers 100% of everything except for 80% of foreign travel up to limits. The thing about Plan F and also Plan C is they are no longer eligible. Nobody's eligible if they turned 65 after January 1 of this year. So a lot of people look at the Plan G, but you can see there going through all the plans take care of not only your Part A hospital coinsurance, but they also take care of that 365 additional days. Part A deductible, a couple of them don't pay the whole thing. That's at $1,408 each time you go into the hospital. Part B coinsurance, almost all of them pay 100%, a couple of them pay 50 or 75%. That's that 20% that you're paying, why Medicare's paying 80%. The annual deductible, that's why the F and the C aren't there. The annual deductible is allowing the other plans not to be Cadillac plans because you have to pay something out, and that's the $198. And then the excess charges, only a couple cover that, and that's going to be down to Plan G now. And then the rest of them, depending on what you're looking for, they all take care of some sort of cost for the first 3 pints of blood. Some of them cover foreign travel emergency. They all cover hospice coinsurance and preventive care. And a lot of them cover some of the costs of your skilled nursing facility. The ones that have limits, they're not paying everything. They do have a out-of-pocket limit for 2020, and you can see those amounts right there, and those are plans K and L. Next slide, please. So a few things to remember with having a Medigap insurance or Medicare supplement. You must be enrolled in Part A and Part B and live in the state where the plan is offered. No medical underwriting up to 6 months after enrolling in Part B or age 65 or older. It's nationwide coverage and no provider network. So you can go to anybody that takes Medicare. Guaranteed renewable. So what that means is it will automatically renew into the next year, and the plans will automatically adjust to take care of the changes in Medicare, like the deductibles going up, or co-pays and such. Plan premiums may vary, even for the same coverage. So that's why it's good to look at the different plans that are out there. And then, of course, if you have more coverage, it's going to generally have a higher premium. And just like with the Medicare Advantage plan, you must continue to pay your Part B premium to Medicare. Next slide, please.
Well, Mary, so real quick question. With so many options available, and I'm sure that's probably pretty overwhelming for a lot of folks. I mean, are you able to kind of sit down with people on an individualized basis and just kind of figure out? Because I mean, especially looking at the foreign travel, I know when I retire, I want to go travel, so I want to make sure I have stuff that's going to cover what I'm looking forward to in retirement and whatnot.
Absolutely, Casey. So, we'll go over where you can get it, because I don't want to be totally, I can help anybody that wants some help. But this is, trying to keep it on the educational side. At the end here, we're
That's
going to
good.
talk about different ways that you can get coverage. And one of them would be through an agent, because people don't realize they don't pay anything for an agent to help them out.
Oh,
It's actually against the law to take a fee for helping somebody with their Medicare. So
that's great to know. All
yeah,
right.
we'll go over all the different ways, including my information at the end here too. So how
Wonderful.
to choose? Go to the next one here. Next slide. There you go. So you have all these different abilities, ways you can get your coverage, whether you just get your Part A and Part B and leave it at that. You'd probably want to tack on a Part D, just so, my preference would be that you have a Part D if you don't have other credible coverage, because you don't want to get penalized. You might need that in the future. You might have your Part A, your Part B, and a Medicare supplement, or you might have, Part A, Part B, your prescription drug, and the Medicare supplement, or you can go with the Medicare Advantage plan. Like I said, most of them have prescription drug already in them. There's only a couple cases where you can get a separate prescription drug with a Medicare Advantage plan, because they tend to cancel each out. In Northern Virginia, we don't really have any of those cases. And then you can also get just a Part C or a Medicare Advantage plan without prescription drug. We see that happening mainly with our veterans who are getting their prescription drugs somewhere else. Next page. And once again, we kind of showed this before, your different, how you want to get your coverage. You first enroll in Medicare, original Medicare, and then you decide what option you want to go with. Next page. So here's a little bit of differences between the two types of coverages to help you kind of level out what makes more sense for you. Medicare supplement pays some of the costs not paid by original Medicare, does not help with drugs, is nationwide coverage. When you're looking at the coverage for a Medicare Advantage, provides benefits of original Medicare and beyond, often includes drug coverage, may have a provider network. Costs, the cost for a Medicare supplement, and then you also have to have a drug plan premium, and you might have also out-of-pocket costs depend on the plan chosen. So you want to look at the premiums, see what that looks like in your budget. With the Medicare Advantage plan, may charge a plan premium, often no additional premium for the drug coverage, co-pays and co-insurance for most covered services, and then the annual out-of-pocket maximum. So those are things we want to keep an eye on and when we're making our decisions. Convenience, You have for the Medicare supplement plan, you can go to anybody that takes, Medicare, it's multiple plans. So you would have 3 different cards that you use. Where the Medicare Advantage plan, it's just one card. It's kind of like I said, like your employer plan. Next slide, please. And when can you enroll? This gives us the information of when. Next one. So you can enroll in Part A and Part B automatically if you're receiving Social Security or railroad retirement benefits at age 65, or after receiving Social Security disability benefits for 24 months. So you'll be automatically enrolled in those 2 cases. If you're not getting benefits, then you need to go to Social Security, ssa.gov or local office to apply for your benefits. You can go 3 months before your 65th birthday, up to 3 months after your birthday month, and 3 months after your 65th birthday to apply. Most people like to go, you can go online and it doesn't take but 10 minutes to apply. If you're just getting to be 65, it's pretty easy. Enroll early to avoid gaps in coverage, because you do need that Medicare number, which is going to be, it's not our Social Security number anymore, but you do need that Medicare number before you can sign up for a Medicare Advantage or a Medicare supplement or even a prescription drug plan. So you need that first. You can refuse or delay enrollment in Part B. We'll see that, and I think they talk about in the slide coming up. Some employer plans don't require you to get Part B, so why would you be paying that premium if your employer plan is going to cover you without having to get that Part B? But there are other employer plans where you have to get your Part B, so it's always good to know what your options are. And then after you get that, you can enroll in Medicare Advantage or a prescription drug plan or a Medicare supplement plan. Next slide. So general enrollment, this is only for when you're getting your need to get Medicare. We're talking about just the government part here. So you can get your Part A and Part B any January through March, January 1st through March 31st. For those who missed their initial enrollment period. You can apply for both or just for one if you didn't apply for Part B, and you may choose to enroll with a Medicare Advantage plan or prescription drug plan for the 3 months after that. And then there's also, most of the time, if you've missed it, the reason you're using this general enrollment period, you're going to get a late enrollment premium penalty for that. Next slide. So Medicare supplement open enrollment period. So to apply for Medicare supplement without having any medical underwriting, as long as you do it within the first 6 months of turning 65, you won't have any, or getting your Part B, you won't have any medical questions to answer. The further you get away for your 65th birthday, the more questions that you'll have to answer to get a Medicare supplement plan. You can be denied on getting a Medicare supplement plan or charged based on your health history. So just something to be aware of, the way it's a little bit different than the Medicare Advantage plans. Next slide. Special enrollment plan periods. So sometimes it's you've been working and you're on your employer group plan and it's credible coverage, so you're not going to get any penalties for not having Part B, and you're not going to get any penalties for not having prescription drug coverage. So the last month of your employment, or your employee health coverage, starts a 8-month timeline where you can enroll in Parts A and Part B if you haven't done that so already. Also, after that, if you get your Part A and Part B, you have 2 months to get your Medicare Medicare Advantage plan Part C, or your prescription drug plan Part D. So a lot of times you'll see this because you didn't need to have Medicare, especially Part B, why you were working, but the Part B will actually trigger the chain of events for the Medicare Supplement Open Enrollment. Next slide, please. So late enrollment period penalties, premium penalties. For the Part A, there's none as long as you qualify for free Medicare Part A. There's a little caveat here. If you, let's say you're only worked for 5 years, and so you do have to pay part of your Medicare Part A premium. Then if you don't get it when you're first eligible, you can get a 10% penalty for that. Part B, if you've qualified for a special election period, like you've been on an employer plan, then there's not going to be any penalties. But otherwise, if you just didn't want to pay for Part B, you will get a 10% penalty for each full 12-month period that you went without Medicare Part B. And that's going to be the cost of what Medicare Part B was at that time. So, and then Part D, there's not going to be, and that's your prescription drug, there's not going to be any penalties as long as it didn't go over 63 days without credible coverage. But otherwise, it is a 1% of the current average of the premium for each month that you did not have a Part D coverage. So it gets a little complicated and adjusts because those premiums change per year. The one thing I'll tell you about that Medicare Part D premium is that goes on forever. So it's not like you can ever, except for in certain instances, that would not just get wiped off eventually. It goes on forever. I try to look at Medicare as a little bit different. People are like, why do I have to get a Part D if I don't have prescription drug, any prescription drugs? I look at it as when we get our employer plan, or we get one from the ACA, you know, we get one from under 65, it has some sort of drug coverage in it. And you don't get a choice of what drug coverage you get. So I always look for, well, we're going to get you the least expensive drug coverage now because we know we can always change that for you. So I always look at it as allowing you to get the level of drug coverage you want to get versus, you know, it being an extra cost. You're just allowed to get, with Medicare, get sorry, I'm not saying that correctly. You get to pick what level of prescription drug coverage you want based on your needs. So I kind of try to look at it a little different, the glass half empty, half full. I like to look at it as a positive that you get to pick your own Part D. Next slide, please. And when can you change your coverage? It's a big question, number 8 here. Next slide. So you can switch. We're right now going into our annual enrollment period, and that is October 15th through December 7th. During this time, you can switch from Medicare's Part A and B to a Medicare Advantage plan, Part C, or vice versa. You can switch from one Medicare Advantage plan to another. You can join, switch, or drop a Medicare prescription drug plan. So with annual enrollment, everybody thinks they can switch Medicare supplements. Generally, when you get on a Medicare supplement, you're staying there and you're just keeping track of your prescription drugs. Next slide. You have an open enrollment period for Medicare Advantage on January 1 through March 31st. And what this means is if you're not happy with your Medicare Advantage plan, you have the ability to switch to another Medicare Advantage plan or drop that Medicare Advantage plan and pick up a prescription drug plan. So you're only allowed one coverage, one change during that period, whereas the annual enrollment period, it's whatever you last signed up for by December 7th that takes effect on January 1. So the difference here is this Medicare Advantage open enrollment is only for Medicare Advantage, and it's basically for you to switch plans or to go back to original Medicare with a prescription drug plan. Next slide. Special election periods. So this is both for Part C, the Medicare Advantage, and the prescription drug plans. If you move out of a planned service area, you have 60 days to change plans. If you move into a plan service area and have new plan options. You have that ability. You lose your health coverage through an employer. You qualify for a special needs plan. So, you know, all of a sudden you get Medicaid. We want to look at some additional plans for you. You have the ability to change. You move in and out of an institution. They may have a good institution plan for you while you're there. So you can move in and out of that. You're getting financial help with Medicare, and that's going to be with generally with extra help for prescription drugs, which is a Medicare program, or you move back to the US after living outside the country. So these are some special election periods that you can have throughout the year. So, and you need to make the choices within 2 months. Next one. And how can you save money? That's what we always want to do. So next slide. We want to, you know, ways you save money, and a lot of it has to do with being healthy. Use your preventive services. Can't say this enough. Get your checkups. You know, that's the biggest way to save money because things are found earlier and they're taken care of earlier. Stay with your plan provider network if they have one. You know, just stay within the network. There's a reason that the doctors are in the network. Then it's going to benefit you too. Ask about generic and low tier drugs. The doctor comes out and offers you a specific drug and it's really inexpensive. Let's see if there's a lower cost alternative for you. Use preferred or mail order pharmacies. That's a big one. A lot of carriers have mail order pharmacy where lower tiers you don't pay anything for. And then also understand your status in the hospital. You understand if you're being held under observation versus being admitted. And like I said, around here, I've seen where they actually, the hospitals are making you sign something you're understanding that you know that you're being held for observation. Next page. For financial assistance, you can always call 1-800-Medicare. Extra Help is a program that helps with drug costs, and that's a Medicare program. So you have to be a member of Medicare to get that. And it can help with not only the cost of the prescription drugs, but also the premiums associated with a prescription drug. Medicaid also provides health coverage for people and families with limited incomes. Medicare savings programs can help with Part A and Part B costs. And then there's also PACE, or programs for all-inclusive care for the elderly, which is usually community programs. And I know Fairfax County, we have that, provides a lot of services for our frail or elderly members. Next slide. Where can you go for help? So next slide. So you can look at MedicareMadeClear.com, just get information about videos, what we've talked about here. This presentation is probably there, but we're going to have that on our chamber website. You can sign up for newsletters to get information off of that website. Follow Medicare Made Clear on Facebook. Visit YouTube page, watch videos on Medicare. And then we just kind of went through MedicareMadeClear.com also has English, Spanish, Vietnamese, and Chinese presentations on there too. Next slide. Didn't really happen as much this year, but every year there's a National Medicare Education Week. I mean, I know last year I was at Springfield Mall talking to a whole group of people. I like to see people. I can't wait to get over this COVID so we can get out and see people more to learn more about Medicare. But hopefully next year you'll see that again. Next slide. More resources are going to be Medicare.gov. You can call 1-800-Medicare. You can talk to your state health insurance assistance program. We have the website right there. You can talk to Social Security or state Medicaid office if you need financial help. Next slide. And then the last one is be involved or talk to an insurance agent. Like I said, they're going to help you find what's going to work best for you. You want to look for somebody who has the ability to help you whichever way you want to get your additional coverage. So I know I have a question in the chat box. I want to thank everybody. I can also get out, you have my information right there. If you have any questions later on, you want to give me a call, 703-508-3096. Comes right to my cell phone, or mary.crispino@healthmarkets.com. You can also contact me through our chamber webpage too. So let's see what questions we might have.
So the question we have is, I am in a transition from working full-time with a much higher income to now working part-time with lower income, including Social Security benefits. I believe Part B premiums are based on 2 years of income. What is involved in appealing for a life-changing event to reduce the Part B premiums?
So so there is an appeal form. Once you apply for Medicare Part B, they will send you an appeal, the information on how to appeal. The income one's a hard one because everybody goes down on their income, and it will come down the following year and the following year after that too. So that may be a hard one, but it's always worth a try to get the amount come down. Where I've seen it really work is if somebody sold their house and taking a large capital gains, where they've been able to say, you know, our income's this low, we've never had to pay more, and just because we sold our house and took that capital gains for that one time, we got that that rise in income. I've seen that be able to be explained away. I would just say that I know I have a lot of customers who are in the same situation, but they see that it's going to probably take about 2 years before it actually comes way down. But when you apply for Medicare Part B, they tell you what to do if you don't agree with the amount, and they call that income related adjustment, or IRMA. If you don't agree with it, they will give you the information on how to appeal that. And I can help you too, you know, fill out the form if you have questions. So.
Wonderful. We have another question of just going over the lifetime reserve days again.
Okay, so lifetime reserve days, we're going back to Medicare Part A, and that's your hospitalization. So Medicare pays for as many times as needed going to the hospital up to 90 days. And you have those 60 days lifetime reserve, which means that if you're in the hospital, and you know, up until COVID, I would think most people aren't in the hospital that long. But let's say you're in the hospital for 90 days, 95 days one time, and then the next time you're in the hospital for 100 days. Well, that took care of 15, because of the 95, that's 5 days, and then the 100 days, that's 10 days of your lifetime reserve days. Does that make sense?
That makes sense. Let's see, for the 2-year income, is this an average or combined income for the 2 years?
It's a look back till 2 years ago tax returns, because a lot of times that first, you know, last year isn't even in, and they pull that from IRS, what you put as your adjusted gross income, you know, so that's what they're looking at there. So, you know, that might be different if you're a business owner, it might be different, you know, and it is a couple, so you can't separate husband and wife away from that. Sometimes that actually helps. Sometimes it makes it harder, because I've had several people, you know, one makes the money and they're like, well, she shouldn't have to pay, or he shouldn't have to pay because she's not making the money. No, it's based on the couple's income.
Okay, wonderful.
Any other?
Let's see if we have any other questions. And no, Mary, I think you've done a phenomenal job explaining a very complicated subject and kind of making some some sense out of the madness.
Thank you.
Uh, as Mary said, please reach out to her if you have any additional questions. She's definitely a valued member of the chamber, but also a professional expert in her field. So it's great to have her here today, and we certainly appreciate it. And as we've mentioned in the past, just go ahead and watch this webinar again. If you have any additional questions, share it out there because at the end of the day, that's kind of what the South Fairfax Chamber of Commerce is here for, is community support, growth and development. We want all aspects of the South Fairfax area to flourish. So so for our attendees that came in here live today, and for those that are watching this afterwards, we really appreciate you for attending. To stay up to date on all the webinars, community happenings, basically what our local businesses are up to. Please follow us or on the please find us on the southfairfaxchamber.org website. We also have our COVID-19 Business Information Center page updated regularly based on our business contributions. And those just to kind of let people know of how they're able to take care of the community, and as far as office hours, what they're doing as far as pickup, that kind of stuff. And then if you have any questions, you're welcome to contact us directly at the 703-550-0005 or info@southfairfaxchamber.org. We'd also like to mention that we do have our upcoming webinar scheduled on November 18th at 7 p.m. It is going to be for our distance learning town hall. And we definitely hope you all join us, follow us, and if you want to have a good solid link for us, follow us on our Facebook page at SFCC, SFC Commerce, SF Chamber Commerce, and at South Fairfax. And if you follow us on those social media platforms, you'll be able to see all the great things that we do to help support our community, what we're doing to put information out there for our community, and lastly, just making sure you know what is going on when we share everything else, because we definitely try to make it a very knowledgeable source to go to. So once again, thank you all for coming. We certainly appreciate it. On behalf of Casey Whitmarsh, the chair of the South Fairfax Chamber of Commerce, we hope you have a wonderful day, stay safe, and we look forward to seeing you at our next webinar.
Thank you, Casey.
Nope, thank you.
All for attending. Thank you.
You were awesome. I got a lot of information out of this. I will be in contact with you.
Okay, great. Thank you.